Well, thanks, Paddy, for that. And we're moving into the Airway Clearance program now. I stretch this over 2 consultations. And the first consultation today, I'm going to look at prescribing you or testing you out on the shaker device, which is a device that helps patients a drug-free approach to mobilise the secretions, which makes them real thin and easier to cough up.
Okay.
Like you were saying, that real sticky, thick phlegm is sometimes really difficult to get off.
Yeah.
And then I'll teach you how to get it off your chest. Consult number 2, we're going to teach you about ACBTs, which is a cycle of breathing techniques, which is a bit more effective on actually expelling the mucus. But today it's about mobilising them and thinning the secretions,
Right.
using the shaker device here. So, first of all, just a few questions about your current condition. Are you coughing up any blood at the moment?
No.
No. You haven't had any lung punctures or been in hospital for a deflated lung or things
No,
like that?
nothing.
Recent heart attack or right-sided heart failure?
No.
No? Excellent. Are you on oxygen at the moment?
No.
No? Any middle ear infection?
No.
No? Excellent. Well, we're screened, we're ready to go.
Okay.
And this is the shaker device here. And I've put on an antibacterial and antiviral filter here. So this is my demonstration model.
Okay.
All right? And what I'll do first of all is to test to see if you can generate the flow, because you are blowing out through the device, similar to a spirometry measure that you might have done before.
Yeah.
So first of all, I'll get you to take almost a full breath in, hold your breath for a little bit, and then blow out at a forceful pace. I don't want you to, you're not like you're blowing a full big birthday cake out,
Right.
just blowing out, and you'll feel the device oscillate. You want to feel the device in your chest. If you start feeling it in your cheeks, you might need to tighten your cheeks a little bit, but we can go through that if we get there.
Okay.
All right. So here's the device. So first of all, this is the mucus loosening phase. Right? So this is what we're shaking the chest and shaking the lungs, getting the mucus ready to come out. Okay. So taking a 3/4 breath or a breath in, holding the breath for 2 or 3 seconds, and then blowing out through the device. Excellent. And do that again for me. Breathing all the way in, almost all the way in. Great. Do a couple more. Normally we'd do 10 of these. This is the mucus loosening phase. And where do you feel that?
Oh, sort of here.
In your chest? Okay, great. Now you'll notice you might need to tilt it up or down a little bit, and that's up to the patient. Sometimes you tilt it up high, you might get some solid vibrations, but what we want is to feel those vibrations. So the position where we are getting the most vibrations. Okay, great. So let's say we've done 10. So at home, when I prescribe you your home program, you'll have 10 of those to go through.
Right.
And then after 10, we move to an elimination phase. So this is a bit more of an effort required by you, expelling air, so blowing out a little bit harder, taking a really deep, full breath in this time, so really expanding the lungs. It's important to hold the breath for a little bit, and then I want you to blow out at a reasonably fast pace.
Right.
So much, much harder than what you're doing just then. This might generate a cough. We do have some tissues available for you if you are productive, but this is the elimination phase. And I only want 2 or 3 of these, please. So all the way in, hold your breath, and then go. Great. You feeling okay? Yeah. And another one again for me. Great. And one more. Great, you okay? Alright. So, coughing.
A little.
So, do you feel any tickles or anything here that need to come up yet, or is it okay? Normally, with the use of the shaker, it's up to an hour after you use the device is when you start being productive.
Right.
Sometimes if you're not productive directly with using the device, it doesn't mean it's not successful.
Okay. Right.
So what we would do now is we would cycle back to the start of that. So we'll get you to do 10 breaths, nice and controlled, and then to that elimination phase again. I'd like you to complete at least 3 of those, so 3 lots of 10, and 3 lots of those elimination phases in our setting. But I'll write that down on our home program now. So it seems like you can generate enough expiratory flow for that, which is great. So I'm happy to prescribe you this program. I'll write down all the information here that you need to perform at home. And consult number 2. When you come back next week, we'll talk about the ACBTs and an effective way to get that mucus off your chest if this isn't effective.
Okay.
Okay?
Yeah.
Thanks very